Hi guys, welcome to today's presentation. So today we are going to look at Dysentry. So we are going to be as fast as possible because we have a lot of topics to look at, and there's just so much things to do. So please bear with me. I'll just run through Dysentry as fast as possible. So let's move on. So let's look at our objectives for this presentation. So at the end of this lesson, you should be able to acquire knowledge on dysentery and you should be able to nurse a patient with dysentery. So our specific objectives are as follows. You should be able to define dysentery, state the 4 species of Shigella that causes bacilli dysentery. Then we've also looked at the amoebiasis, which is amoebic dysentery. So you should be able to also state or explain what amoebiasis is. Then you should be able to explain or describe the pathophysiology of dysentery. You should be able to state the signs and symptoms of dysentery. You should be able to state the medical and the specific nursing care plan for dysentery. And you should be able to state the complications of dysentery. So let's look at the introduction. So under the introduction, we are saying dysentery is an infection of the intestine resulting in severe diarrhea with the presence of blood and mucus in the stool. So when we come to the definition, so we can define the dysentery as this is an infection that affects the gastrointestinal tract in which there is inflammation of the intestines. It is caused by the Shigella species. It could be any type of the Shigella species or Entamoeba histolytica, which is transmitted through oral fecal route, and it is characterized by bloody diarrhea with mucus. So that's how we can define dysentery. So it is an infection that affects in the first place. It starts with the gastrointestinal tract, the intestines in particular. So it is transmitted through the oral fecal route. Then we have the species of Shigella that causes it. We have the 4 different species of Shigella that causes dysentery. Then we also have amoebiasis dysentery, which is caused by the bacteria known as Entamoeba histolytica. So it is characterized by bloody diarrhea with mucus in it. So with that definition, you can get your 5 marks. So now let's look at the type of dysentery. So we have 2 types of dysentery. We have the bacilli dysentery and the amoebic dysentery. So the bacilli dysentery is also called shigellosis. It is caused by the 4 species of Shigella. So we have the first one is Shigella soniae, the second one is Shigella dysenteriae, then Shigella phoenixiae, and the Shigella bodiae. So these are the 4 species that causes bacillary dysentery. So when it comes to amoebic dysentery, it is also called intestinal amoebiasis and also called amoebic colitis. Then it is caused by a protozoan called Entamoeba histolytica. So this one is also called tissue dissolving. So after looking at the pathophysiology, you are going to know why it is called tissue dissolving. So during the exam, they may just ask you to write about one type of dysentery, either bacilli dysentery or amoebic dysentery. So when it comes to amoebiasis, so it is caused by a bacteria known as the Entamoeba histolytica. So it enters into the body during the 6th stage of its life cycle. So this cyst may be found in water or any type of food contaminated with human stool. So once it enters the GIT, it breaks down and it releases an active form of an organism called a trophozoite. So I'll just go through that again. So what happens during amoebiasis is that the bacteria enters into the body during the cyst stage of its life. So this cyst can be found in the water or in any food which is contaminated with the human stools. So once it enters into the GIT, it releases or it breaks down and releases an active form of an organism called a trophozoite. So the trophozoite is the one which invades the tissue lining of the intestines, where they are usually secreted in the patient's stools. So these trophozoites are the ones now which goes to infect the tissues in the lining of the intestines. And at this point, these bacteria can even be found in the patient's stool. So they sometimes penetrate the lining itself, so they will start infecting now the lining of the intestines. However, they also enter into the bloodstream. And once this happens, the trophozoites may be carried to the liver, the lungs, and other organs. So when the trophozoites are now, when they enter into the bloodstream, they are carried to different organs of the body, such as the liver, the lungs. At this point, it is now called metastatic amoebiasis. So now it is not only in the intestines, but it is also found in other parts of the body, such as the liver and the lungs. I hope we are together. So that's it about amoebiasis. So remember that it is caused by Entamoeba histolytica. Then it enters into a human body during its cyst stage. So the cyst can be found in the water, in the food, which is contaminated with human stool. So once it enters into the GIT, it breaks and it releases an active organism called a trophozoite. So this trophozoite is the one which will now start to infect the lining of the intestines. At this point, these bacteria can even be found in the stool. So from there, they'll start now to enter into the bloodstream. Now, as they are in the bloodstream, they'll enter into the systemic circulation, where they'll be carried to different parts of the body. And that is called, at that point, it is called metastatic amoebiasis. So let's move on to bacillus dysentery. So it is also called shigellosis. So bacillus dysentery is also called shigellosis, and it is caused by the Phogenus shigella species. So these are the ones. So the first one is Shigella dysentery. So Shigella dysentery is the most virulent species and most likely to cause epidemics. So it's the most virulent, and it's the one which is likely to cause epidemics, the outbreaks. So when it comes to Shigella soniae, it is the mildest species and it's most a common form of Shigella found in the United States. So that's Shigella soniae. Then Shigella bodiae, it causes Litter's syndrome, which is a type of arthritis that develops as a late complication of shigellosis. So that's about Shigella bodiae. Then Shigella fraxinile. This one is chiefly responsible for endemics and epidemics, shigellosis, and it is more common in developing countries such as Zambia, Malawi. So this one is the one which usually affects the developing countries. This one. Okay, so now let's move forward and let's look at the transmission. So the transmission of dysentery can occur, it is through the oral fecal route. So it can also be transmitted from one person to the other, close contact with an infected person. So that's why the patients with dysentery are isolated, because we want to prevent the spread of the infection. Then flies can also cause can also facilitate the transmission of the disease. Then infected water which is infected with the bacteria. Then any objects also which can carry the microorganism can facilitate the transmission of the infection. So now let's look at the epidemiological distribution. So under epidemiological distribution, we see that dysentery, like 99% of it occurs in developing countries, and it mainly affects children. And this is due to poor sanitation and overcrowding. So as we can see in this picture, I think looking at this picture, you're able to relate, you're able to remember which places looks like this. So this is why dysentery is more common in developing countries, because of poor sanitation and overcrowding. So now let's look at the risk factors. So under the risk factors, we have using public swimming pools, traveling to dysentery endemic areas, then close contact with infected person, working in daycare with high possibility of infected children. Also consumption of contaminated water from the rivers or lakes. So these are the five risk factors of having dysentery. Then the 5 F's, so these are just the things which can carry the microorganism. We have the flies, the fingers, the fields, food, and the fluids. So these things can likely carry the microorganisms which can cause the infection. So now let's look at the pathophysiology. What happens? So under the pathophysiology of dysentery, as you can see through this picture, it affects mainly the gastrointestinal tract and the intestines. So Shigella organisms enters the GIT. So they enter through the oral fecal route. So they enter through oral. So when someone ingests contaminated water or food which contains the Shigella microorganisms, they survive the acidic conditions of the stomach. So the acidic condition of the stomach does not affect these bacteria at all. So and about 10 to 100 microorganisms can cause an infection. So you don't need to take thousands of the microorganisms for you to have an infection. Just 10 of them can cause severe infection. So they enter through the GIT, they pass through the stomach freely, then the microorganisms invade the tissue that line the colon and start to secrete an enterotoxin or a harmful protein that attacks the intestinal lining. So they've entered the GIT, they've passed the stomach freely, and then they go to the intestines. So when they go into the intestines, now they start to secrete or to release an enterotoxin. So this is a harmful protein that attacks the lining of the intestines. So when this protein, when the enterotoxin starts to attack the lining of the stomach, it will cause inflammation. So this brings about inflammation, which results into swelling due to the water leaking from the capillaries of the intestines. So we know that when the injury occurs, there is inflammation, and inflammation will result into swelling where there is leakage of water from the capillaries. So when this happens, there is edema. Yeah, so there is further tissue damage by both immune cells, and the chemicals are released. The cytokines will be released to fight the infection. So now what is happening is the Shigella, the microorganisms have entered into the intestines. Now they start to release the enterotoxin. So this enterotoxin will now start to affect, or it will start to injure the lining of the small intestines. Now, when that injury comes in, there is now inflammation. Inflammation which will result into swelling and water leaking from the capillary, ulceration, and all those things start to happen. Now the body, the immunity also realize, oh, something is wrong here. We have to fight this infection. So during the inflammation, the cytokines, which are chemical inflammatory mediators, will come in now. So that will result into severe damage of the lining of the intestines. So now, once infected, all the Shigella species multiply and cause bloody diarrhea. And this is what happens. So by invading the chronic epithelium, where pro-inflammatory cytokines are released and subsequent inflammation reaction occurs, then there is destruction of the epithelial lining of the gut, of the GIT. So there's the inflammation in the gut, in the mucosa lining of the intestines, allowing for further direct invasion of the Shigella. So there is ulceration. So the layer, the cells, the epithelium, they are exposed. There's nothing to protect them. Now the Shigella is so free to even attack the body tissues freely, because now there's injury, there's this inflammation which is taking place. Now the bacteria are multiplying, and there's just severe damage which is happening to the body tissues. So the Shigella are now invading into the tissue and just causing destruction in the intestines, and that is what will result in blood being found in the stool and mucus. So that's about the pathophysiology of dysentery. So maybe in summary, we can say when the Shigella species or the Entamoeba histolytica enters the GIT, they passes through the stomach freely. They go into the intestines. So when they enter into the intestines, they start to circulate or to release the enterotoxin. So this toxin will now cause injury to the lining of the GIT, the intestines. So that will result into inflammation. So when inflammation occurs, we know that there is increased blood flow to the injury site, there is swelling, there is leaking of water from the capillaries into the tissues. So that will result into the swelling and all those things, ulceration, which will come about. And when there is that damage to these body tissues, which are in the intestines, the bacteria now will freely attack the body tissues, the cells, causing severe damage to the intestines. As a result, there will be blood leaking out of the injured sites, and mucus will start to be produced, and it will be evident in the patient's bowel. As a result, a patient will start to have blood and mucus into the stool. So in summary, that's how we can summarize the pathophysiology of dysentery. Now, the incubation period is about 48 hours, but it can range from less than 12 hours to 6 hours. So now let's move on to look at the signs and symptoms. So signs and symptoms as follows. We have tenesmus. So this is a feeling that a patient will have, like they want to go and open bowels. So when they go to open bowels, there is nothing which will come out. The stool will not come out. They just have the feeling that they want to open bowels, but the stool is not coming out, and this is because of the edematous and inflamed colon. So there is painful streaming to empty the bowels or the bladder without evacuation of stools or urine. This is due to the edematous and inflamed colon. So this is what we just talked about. Then there will be fever. Fever is simply because of the inflammatory process which is occurring in the GIT and the entire body. Then there is also frequent passage of blood and mucoid stools. So this is due to the ulceration of the colon which has taken place. Then there is also headache, which is related to the presence of toxins in the body. As we saw during the pathophysiology, that the bacteria starts to release the enterotoxins. Then there's also the release of the cytokines. So this, as a result, the patient will have headache. Then there is body malaise. So body malaise is related to the presence of toxins as well. So those are some of the signs and symptoms of dysentery. So there is also dehydration, mild dehydration. So dehydration will depend on the severity of the diarrhea. So if the patient is having a lot of diarrhea, like they are passing a lot of loose stool, it means they may have severe dehydration. Now, if it's moderate, they may just have moderate dehydration, which is due to the frequent passing of watery stool. So those are some of the signs and symptoms of dysentery. So we've looked at one, tenesmus. Then we have fever. There is frequency of passage of blood stool. Then we have headache, body malaise, and some dehydration. So we've just talked about 5. So I'm sure we can find some more. So now let's move on to look at the medical management. So under the medical management, we can look at the investigations. We can do a rectal swab for culture and sensitivity. So a swab can be taken from the rectum for culture and sensitivity, which will help us to know the causative organism, what is causing. Is it Shigella? What type of Shigella? Or is it Intermoeba histolytica? So then we can do a physical examination of the stool. So we should be able to look at how the stool is looking. Is it bloody or is not bloody? So if it's bloody, that's how we are going to know that this is dysentery. Then a full medical history can be taken from the patient, which can reveal the predisposing factors such as a patient coming from an endemic area, or maybe they sell at the market where the sanitation is poor. Then we can also do a full blood count. Remember that this patient is losing blood, so we want to rule out anemia. Then also it will review the increased red or white blood cells, which will just show that this patient has got an infection. Then we can also collect blood for blood culture, as we saw from the pathophysiology that at some point the bacteria, they go into the bloodstream. So when we collect blood for blood culture, it may help us to know the causative organism. Then stool for microscopic culture and sensitivity can also be done. Then when it comes to medication, depending on the level of dehydration, management of dehydration will depend on the level of dehydration. If it's severe dehydration, we are going to do plan C. If it's some dehydration, you are going to do B or A. So dehydration will be managed according to the level of dehydration. Yes. So when it comes to antibiotics that are going to be given, nalidistic acid can be given dose as stated. So nalidistic acid 500 milligram QID for 5 days can be given. So its action is that it inhibits replication of the bacterial DNA by blocking the activity of the bacterial DNA, and it's a bactericidal. So it kills the bacteria itself. So some of the side effects are nausea, vomiting, abdominal pains, and all those. So as a nurse, make sure that you're observing the patient for these things. So under nursing implications, observe patient for vesicular arrhythmia when they are combined, when an nalidistic acid is combined with beta blockers, then give an increased dose when giving with calcium salts, then observe the patient for any convulsions, then before giving, ask the patient if they've had any anaphylactic reaction to any antibiotics. So we don't want to give the patient the drugs that they can react to. The other antibiotics which can be given is ciprobit, ciprofloxacin, which can be given, the dose is 250 to 500 milligram BD. The same action. The side effects, we have nausea, vomiting, abdominal pains, and central nervous effects, dizziness, headache. So other drugs which can be given, paracetamol can be given. So these are the same nursing implications which can be done by the nurse. So other drugs which can be given are paracetamol 500 to 1 gram TDS orally for 3 days. It can be given to reduce fever or for any abdominal pains. So yes, it will be given according to the doctor's advice. So let's now look at the specific nursing care which can be given. So you just do well to go through this nursing care plan because it's specific for the patient with the dysentery. So the first problem that we identified was the thermoregulatory failure or fever, which can be written in different ways. You can say altered thermoregulation or fever or thermoregulation failure. So the nursing diagnosis is that thermoregulation failure related to the presence of infection in the body, evidenced by patient's body temperature of 40. So now our objective will be to reduce the temperature by 1 degree. So it depends on how you want the temperature to be reduced. So what are the nursing interventions? So you want to make sure that vital signs are monitored. So you are noting specifically for temperature, if it's reducing or note, so that appropriate measures are taken. So first, for you to even know that this patient has got fever, it means you have monitored temperature, you are monitoring the vital signs. So vital signs should be done hourly. And why are you doing that? You want to detect if temperature is reducing or not. That is, if you've already noticed that the patient has fever, then you are doing now the interventions. So the second intervention is that you're going to remove extra linen and extra clothing. So why you're doing that is you want to reduce fever by convection. Then you are going to open nearby windows to allow cool air to enter into the room, thus reduce fever through the process of evaporation. Then tepid sponging can be done to reduce fever by evaporation. Then you are also going to give prescribed analgesics such as paracetamol. You are going to give as prescribed. Why are you doing that? Because you want to reduce fever. So our outcome would be that after the interventions, the patient's body temperature has reduced, evidenced by body temperature of 37. So the other problem is the painful defecation. So the patient will be complaining of pain when going to the toilet. So the nursing diagnosis is that painful defecation related to bowel inflammation, edema, and ulceration, which is happening in the colon, which is evidenced by patient crying or complaining of pain when opening bowels. So our goal is that our patient should experience reduce pain to reduce pain experience when defecating. So when the patient is opening bowels, we don't want them to be experiencing pain, or we should reduce it as much as possible. So our interventions are that you're going to assess the level of pain using the scale of 1 to 10. So you should be able to ask the patient from the scale of 1 to 10, how can you rate your pain? And that's where our interventions are going to come in. So we are doing that because we want to give appropriate measures. If it's severe pain, we are going to give the drugs which can help with severe pain. If it's moderate pain or if it's less pain, we are also going to give measures according to the level of pain. Then the other intervention is that we are going to give prescribed apparatus. So these are going to soften the stools. Then we are going to give prescribed analgesics such as paracetamol. So we are doing that to relieve the patient from pain. Then here is supposed to be good, not God. So please take note of that. Yeah. Here it's good position. When putting the patient on the bedspan, we want to make sure that we put them in the position where they are not experiencing so much pain, and we are doing so to avoid pain. So then we are going to give prescribed antibiotics such as nalgesic acid to combat the infection. So the other problem is mouth dehydration, which we said can be managed according to the level of dehydration. So the problem is mouth dehydration. The nursing diagnosis is dehydration related to frequent diarrhea. Our objective is to rehydrate the patient and provide the nutrition that they need. So our interventions are to assess the level of dehydration so that appropriate treatment is given. Then give ORS to replace lost body fluids and electrolytes. Then we are going to encourage oral fluids and meals to promote the nutritional status. Then we also want to weigh the patient daily at the same time. So notice that when the patient is just coming in, we are going to take their weight for baseline data. Then every day we are going to be assessing the weight of the patient to make sure that the patient is not losing weight. So if they are losing weight, we are going to manage them accordingly. Then we are going to also monitor bowel movements, noting the color, consistency, and the frequency. So this should be recorded. So we are doing this so that we monitor patient's progress. Then this should be recorded on the fluid balance chart. So we should take note that we record how many times the patient has had the diarrhea and what type, how is the consistency. Is there blood? Has blood continued or has it stopped? It means we want to know if our treatment is working. So if there is no diarrhea or if there is reduced amount of blood, or the blood is reducing, or there is no blood, it means that our treatment is working. And if the blood continues to be in this too, it's also showing us something that we need maybe to change treatment, or we need to put some more interventions. So our evaluation is that the patient is no longer dehydrated, evidenced by patient not having any sign of dehydration, and they are maintaining their normal body weight. So the other problem is that there is high risk of spreading the infection. So the diagnosis is that the nursing diagnosis is that high risk of spreading the disease related to the nature of the disease itself, because we know that it is infectious. So our objective is that we want to avoid the spread of this infection. Our interventions are that when we are attending to this patient, we are going to be putting on the gowns, the gloves when attending to the patient. Why are we doing so? Because we want to prevent infection prevention. Then we should put a basin of water at the door of the room where the patient is, so that there will be hand washing after attending to the patient. Then we want to isolate this patient and limit the number of visitors. Why are we doing so? Because we want to prevent the cross infection. Then we also want to disinfect all the utensils and linen by soaking in jik 1 to 6 parts. So why are we doing this? Because we want to prevent the infection. And evaluation will be that the patient, the infection will be controlled. It won't be spread to others. So the other one is the knowledge deficit on the prevention of dysentery. So the patient won't have any knowledge about how to prevent dysentery. So our nursing diagnosis is that the patient do not know how to prevent dysentery because they are not exposed to this disease. So our aim is that we want to educate our patient on how to prevent dysentery together with the family members. So our nursing interventions are that we have to explain the disease process to the patient and relatives to promote understanding. We should explain why the patient is being isolated, because if they do not understand why we are isolating the patient and why we are limiting the number of visitors, they won't comply. So we want them to comply, and they can only comply and they can only cooperate when they understand what we are doing. So we have to educate them. We have to explain to them why we are isolating the patient. Then we also explain the importance of hand washing the patient and relatives to promote infection prevention. So we have to make sure that we explain to the patient and their relatives. So this is the specific nursing care plan that we can give to a patient with dysentery. So let's quickly look at the complications. So under complications of dysentery, we have septicemia. So this will come about due to the bacteria going into the blood, infecting the blood, and going to other organs of the body. Then we have arthritis, and we said Shigella Bodier is the one which causes this type of arthritis. Then there can be conjunctivitis. Then there is also chronic colic, perforation. So this is where the intestines, the large intestines, become perforated because of the ulceration and the inflammation which was taking place during the disease process. Then encephalopathy can also come about when there's involvement of the brain. Then there is also lectoprolapse, which is common in children because the rectum is destroyed because of inflammation and the ulcers. So it will just um, it will be just misplaced. So there will be lectoprolapse because of that. So we've come to the end of this lesson. It has been quite interesting, and I've been as fast as I could be to beat time. So you can just take time and go through it properly. So comments are welcome and questions are welcome. So remember to subscribe, like, and share. Thank you.